The horror at the Uvalde school raises questions about mental health resources all across the country, including right here in St. Louis County. 5 on your side, Sydney Stallworth met with Dr. Sam Page, who spoke just hours ago about gaps in the system and the plan to expand resources for residents.
St. Louis County Executive Dr. Sam Page says there are 2 areas the county should focus on: mental health case management and substance abuse treatment. The tragedy in Texas has magnified the need for resources like these. I asked him why the change in system is so necessary in the wake of this shooting.
First of all, I think we need stronger gun laws in this country. At the local level, our control is mostly about providing mental health services, and we have exhausted our existing resources for the services that we have.
Dr. Jamika Cooper of Webster U's psychology department says this behavior is far beyond the scope of a typical mental health case.
Sometimes it's a vendetta, it's revenge against teachers that you had when you were in the 1st grade who didn't treat you right. It could be peers that teased you or bullied you. And now you want to seek revenge on the context or the environment in which that happened.
Last year, St. Louis County Department of Public Health treated about 2,500 people for mental health issues. This year, over 3,000 patients are expected to seek care. That's more than the department has treated over any of the past 5 years. More than 40% of people coming into county jails have a mental health diagnosis, and St. Louis County has seen a steady rise in drug overdoses. 343 back in 2020 and 2021, a record high. Dr. Page says funds from the $74 million unused dollars from the American Rescue Plan and the $45 million the county is set to receive from the state's opioid settlement can go to use expanding care options here in the county. St. Louis County has 3 clinics to address mental health issues. He hopes to expand a North County clinic like this one and hire more case managers to help with things like housing and employment. He also says that a plan regarding substance abuse could be coming out in the next few weeks. Reporting from Berkeley, Sydney Stallworth, 5 on your side.
Today, we can't help but think about the mass shootings at Parkland High School, Columbine, and of course, Sandy Hook Elementary. One of the survivors from the Parkland massacre spoke out today to explain the impact an event like this has on a person, especially a child.
Especially when you're young and in these schools, this happens during the formative years of your life. So these students are going to be going back into school soon, and they are going to live lives and have childhoods and early adulthoods that are completely informed by this tragedy. And from what I've seen with Parkland and with all these other horrible shootings, it changes people forever.
Now, trying to explain a school shooting or any mass shooting can be tough, especially when you're talking with kids. According to mental health experts, it's important to be open with your kids. Ask them, how did you hear about this? What are your thoughts about it? Do you feel scared or nervous? Kids need to know they're understood and that they can freely express their fears. Project 5 and Behavioral Health Response are teaming up to help you cope with the news of the mass shootings. If you or anyone you know needs mental health support, it's available right this minute. You can call 314-469-6644 until 10:30 tonight and talk with a counselor right now.